It is the Saturday Town Hall edition of the Front Page with me, Dominique DiPrima. We do this Monday through Friday from 4:30 a.m. to 6 a.m. Hope you'll join us then. We have open phone lines on Tuesdays and Fridays, too. So if you got something to say that's, out of left field or just informative, you can call us then. Love to hear from you. Also, a lot going on around here at KJLH. It is the Men's Empowerment Summit today. Kicks off right after this show at 10 a.m. live at kjlhradio.com, and you can get it anytime on demand. I'm looking forward to that panel with Howard Hewitt and Kevin Nash on relationship negotiations. But that's just me. You can learn about building wealth, justice reform, keynote speaker D.L. Hewley, and more. It should be off the hook. Okay. So it's 9:29 in the morning. We've got qualified guests. We've got you on the phones. Gerald Durant with LA City Fire Department for decades. He's also the president of the LA City Stentorians, the Black Firefighters Association. Nurse Alice Benjamin is a cardiac clinical nurse. She's an ER nurse. She's a medical correspondent and much, much more. Look, they can answer your questions, and that's important. Before we jump back to the phones, which are quite hot right now, we'll start with you, Nurse Alice. People say it's just like the flu. People die from the flu. Why are we doing all these lockdowns? It's something else, a conspiracy, or it's a lie, or, that kind of thing, because we don't lock down the country for the flu.
No, correct. We do not lock the country down for the flu, but we've not had this amount of deaths in a short period of time. We've had more deaths related to COVID-19 than we've had for the last 6 flu seasons, all combined together. I mean, the way that this virus is spreading and the speed in which it's causing people to die is atrocious, and we have to act. We have to be very diligent. We have to put our foot down, draw a line in the sand, and all those things, unless we want these numbers of deaths to continue, because they will continue if we don't do something. So that's why the lockdown is important. And this is the thing. This is the problem. We were slow to the game. We were slow to start, where other countries were like automatically shutting everything down, borders closed. We Americans, we got so many rights and so many freedoms. We were allowed to kind of do our thing because we have rights.
Yeah, but also we had a useless president that didn't help. Yeah.
Oh, well, yeah. Him too.
Okay, it's a great point, though.
Poor leadership. Mm-hmm.
Yeah, it's a great point. It's why it's worse here. Gerald Durant, sounded like you wanted to chime in there on, this theory that folks have that it's just like the flu. Why are we shutting everything down? And also maybe adding on to that, people say, well, people get it, they recover, no big deal.
People cover it, but like we were talking before, if you have some pre-existing problems as far as health is concerned, it's not going to help it. The flu, yeah, we've had the flu around for a long time, but this is different. People are dying. It is taking over. It is, and matter of fact, from what I understand, there's more things going on. Once you recover from it, you could have problems for a long time. This is something that might try to go away, but when it comes back with a vengeance. I think don't take this lightly. And those who do take it lightly, they end up paying in the end. When we had Ebola around, we didn't take it lightly. This is the same thing. It's not the flu. It's worse than the flu. You just stay safe. Clean yourself. Wear your mask.
And starting tomorrow, by the way, we are on a statewide, it's a regional stay-at-home order. So the region of Southern California goes into stay-at-home order at 12:59 p.m. Tonight. So what that means is that 12:59. They mean AM. They must mean AM, because it's for Sunday, right? It starts Sunday because the ICU capacity has dropped to 13%. So no in-restaurant dining, retail. A lot of retail will stay open, but it's going to be at 20% capacity. No playgrounds, recreational facilities, hair salons, barbershops, all that personal care is shutting down. There is no outdoor, no indoor, no nada. Museums, zoos, aquariums, theaters, movie theaters, wineries, bars, breweries, family entertainment centers, card rooms, live audience sports, amusement parks, all shut down. And no gatherings of any kind will be allowed. This is going to last for at least 3 weeks, and then they'll check in 3 weeks if the emergency, the ICU capacity goes back up. Then we'll be allowed to reopen. Schools, that if schools are open, they'll be allowed to remain. And, non-emergency medical dental care will be allowed to remain, child care. But a lot of the retail is just going way, way down to like 20% capacity. So it's going to take some patience, and it's not going to be fun, but it is what it is. It's real, and it's starting tomorrow. Plus, mask use is now in Southern California going to be mandatory anytime you are indoors if you're not at home. So it is what it is. We'll get through it, and it's not going to be fun, but it's going to be necessary. We have an anonymous caller again. Good morning, Anonymous.
Good morning.
What is on your mind?
Okay, so I am currently a contact tracer for LA County. And what I'm finding out is when we're contacting the positive cases, they're not willing to give you information on who they've been around or contact, which as if, they have a plague or something that they don't want to tell nobody that they have it. And it's like so disheartening when somebody don't want to give you information or they really don't even want to talk about it. And you're just trying to stop or slow the spread of this, this virus. And also, even when you have friends that are positive, they're saying, oh, this is a numbers game. I'm not talking to public health about this or, things like that. That's my first question. And my next thing is, if once you have COVID, can you get it again? That's the question.
Okay, really, really interesting stuff. Stay on with us for a second, Anonymous. This idea about contact tracing, and, I understand it. People want their privacy. But what you're saying is if you don't tell the contact tracer, who you've been around, you could be putting that person in danger, right?
Right.
So your thoughts on that? Nurse Alice Benjamin, you want to talk just quickly to that? She's saying people aren't cooperating with contact tracing, so she can't help people get help.
Absolutely. Some people are ashamed or fearful of telling who they've been around. And there's also a group of people who maybe honestly have forgotten because they've just not kept track of who they've been around. Maybe they went somewhere they're supposed to be. So I think that's why we're having some people who are afraid to admit these things. And I think there's just so many unknowns. They're also probably afraid that they might be labeled or tagged some way in some type of system that might later have repercussions. There's a lot of mistrust, with tracers and this whole coronavirus. So if people aren't trusting the tests and the medications and the information, they're definitely going to be skeptical about someone asking them about their whereabouts and what they've been doing.
Gerald, Durant, you have any thoughts on that? I mean, people saying it's a numbers game, people not wanting to, cooperate with contact tracing.
If contact tracing calls you and you don't want to, talk to them, you need to call the friends and family that you were around to let them know that you are positive. The contact tracing, it's another way they're just trying to stop the virus from spreading. They want to make sure everybody gets checked. They want people tested.
Right, but if you let's say you take a test and it comes out positive, then contact tracers start calling you. Couldn't it potentially down the road be a scenario where they say, well, even if you tested negative, you have to stay at home or quarantine, where your own movements could be curtailed.
You know what? That's one thing.
Go ahead, Gerald. 1 second, Nurse Alice. Go ahead, Gerald.
I was going to say, that's one thing we don't always know exactly what that means if they're going to do contact tracing, whether it's good, bad, or ugly for us. I think the main thing is if you have a positive test, do what is required to help keep people alive.
Go ahead, Nurse Benjamin. I know you wanted to add to that. Nurse Alice.
No, thank you. So I've been at some of the testing sites at Charles University when they were doing that there, and there were times where we would have to call people back that had positive test results. And I think some of what's also difficult for people is that the contact tracers love them to death. You know what their role is, but sometimes it comes so late into the game that I tested positive. A couple days ago. Now the contact tracer's calling me several days later. Well, I don't remember, and so all of these things. But one of the most important things that the contract tracer can do is as much as possible try to get the information. But like he was saying, make sure that in the interim, even if you don't know if it's positive or negative, you want to be mindful of who you're around. And talk to your loved ones. You need to talk to your loved ones and let them know, I want to go get a COVID test. I think even having that open conversation is helpful because it puts it on the radar. So even if in the waiting game, people will be more receptive to okay, they took a test. Something might be going on. Let me make sure I take extra precautions.
Got it here. And her other question was, can you get it again? And I know that they're saying you can. It's rare. It seems to be pretty rare, but they don't really know, right?
That is correct. It's uncommon, but they're seeing some cases of it. So we don't have a lot of information on it yet. There's a lot that we still don't know that we're going to be learning about this disease process.
Okay, going to Gina, calling us from LA. Good morning, Gina.
Thank you so much for having the show, and thank you to your guests for being here. I would like to find out, I live in a non-smoking building, and there is somebody that does smoke in the building, and it comes in my apartment as if I had 20 people in my apartment smoking. And I'm just wondering, can you get COVID through cigarette smoke if that person has it? And then also, and then also, they say to quarantine if you came in contact with somebody or if you had the virus. So I'm just wondering, through the quarantine for 14 days, how does that make you, if you're not taking any medication or anything?
Well, the quarantine is not to cure you. It's not to cure you. It's to make sure you didn't catch it. So if you were exposed to someone, then you stay away from everyone else for 14 days so you don't get other people sick because you won't know for sure if you're sick or well for those 14 days. Of course, unless you were asymptomatic. So that's why they say I think now they're saying 5 days if you have a test. And 10 days if you don't. It doesn't have anything to do with curing you, unfortunately. It just has to do with protecting others that you may come in contact with. But let's circle back to her question.
Does it subside after those many days? If you
I think got it. Thank you, Gina. I gotta take other calls. Okay. You've asked a bunch of great questions, so let's go with those. After the 14 days, what happens? Why are we okay to go out after 14 days, Nurse Alice?
Well, once you come in contact with the virus, if you have it, you're going to develop symptoms within that 2 to 14 day window. So if you've come in contact with someone and it's been 14 days, it's safe to say that you likely don't have it because you've not presented with any symptoms. Now, I'm just going to put a little caveat out there. There are some asymptomatic people out there. So there is still the potential that you might be infectious. So that's why we ask you to quarantine, just in case you're asymptomatic. You don't go spreading it around to people.
And Gerald, Durant, can you answer the question about whether it's going to spread through cigarette smoke?
I couldn't tell you that, but because we're talking about droplets, and droplets, whether they're big or small, have a certain distance they can go. So I don't think that they are going to get spread through a ventilation system in an apartment building.
Right. So you probably would have the 6 feet of distance in that case.
Exactly.
You want to comment on that, Nurse Alice?
No, I can just add to that. So if COVID were truly airborne, like tuberculosis or something like that, then yes, it could spread through a ventilation system. But because these are droplets, the droplets are going to, at a certain period of time, typically after they've traveled about 6 feet, are going to fall down to the ground. So it's not likely that it will spread through that cigarette smoke unless she's within that kind of 6 feet of someone. But it's like in a whole other space, I doubt that coronavirus will spread that way.
Going to Deanna, calling us from LA. Good morning, Deanna.
Hey.
Hello, you're on the radio. Go ahead, please.
You okay, Gerald? I'm okay, Gerald.
Do you have a question, or are you just over here doing shout-outs and party all the time, huh? Okay, we're keeping it moving. Thanks anyway, Deanna. Let's go to Ruth, calling us, I believe, from Gardena. Hi, Ruth.
Hi there.
Hi.
Didn't hear.
Ruth, can you turn your radio down? Because it's on delay, so it's going to confuse you. If you could turn the radio down and just talk to me, that'd be great. Thank you.
Okay, is that better?
It's much better. Thank you.
Okay. I have two questions. I don't know how long the immunity will last when you get the vaccine. And the second question is, on social media, I'm hearing about the vaccine changing one's DNA. Can someone discuss that? What does that mean? How does it affect a person?
Okay. Can we just all stop getting information about COVID and the pandemic from social media? Can we just start there? Because it is the single most unreliable source of information. I mean, can we go to the CDC website? Can we look at scientific journals? Can we look at reputable newspapers like the New York Times, LA Times? Anyway, sidebar. So what about that? Do you know? And by the way, it's two. You're going to have to get 2 shots. You're going to have to get a shot. And then I think it's about 3 weeks later, you'll have to get a second shot. And you don't become immune until after you do the second shot. Do we know how long that immunity lasts, Nurse Benjamin? Nurse Alice?
You know what? I do not know. I mean, there's still a lot of information that these pharmaceutical companies need to release to us. And you have to imagine that these studies, haven't started not too long ago. So it's going to be some rolling out of information as they keep going. Because even after these vaccines start, once they're deemed safe and get FDA emergency approval, we're going to start getting them. And then even still, these pharmaceutical companies are going to keep collecting data as more and more people are getting them. So we really don't know exactly how long the immunity will be provided. I mean, what they were initially projecting is they're hopeful that it might be something like the flu shot, where maybe it's something that we can get once a year and it'll provide us immunity for that long. But we still don't know if it'll give us that long yet.
Right. And I'm reading here, I'm Googling it for you, Ruth, and it's telling me from reputable news sources that they still don't know entirely. So as Nurse Alice said, we'll probably be getting more information as we go along. Anything you wanted to add in response to what Ruth said, Gerald Durant? I mean, she's reading on the internet that, the vaccine will change your DNA. And I don't know if you want to comment on any of that, Gerald Durant.
Well, when you talk about the science and the biology of all of it, it takes years of understanding even DNA and how it works and how it manifests through your body. There's no telling what it actually does when it gets into you, what it does to you, But I don't think that's the thing for us to worry about right now. I think just if you feel like you want the vaccination and when it comes available to you, go take it. And there's a lot of people who don't like vaccination in itself. But if you're going to go out of the country to certain parts of the world, it's required you to get vaccinated before you go. And that's to keep you from catching certain disease like yellow fever or something else out there.
Right.
So vaccines are built to work. And I know this is coming along pretty quickly as far as the science and getting the vaccine out. It's a little bit untrustful, but at some point in time, hopefully the scientists and the people with the knowledge and have been studying for years and years and years have done it right.
We heard a lot of great information from Dr. Nelson earlier in the show. But Nurse Alice, can you add to this? I haven't read anything about it changing your DNA. I think that may be coming from the name of the type of vaccine that's making people think that. But I don't know. Do you have any information about that?
Right. So injecting RNA into a person doesn't do anything to change the DNA of the human cell. What's happening is that it's giving the body instructions with how to fight off a virus. So it's not really changing it per se, but it's we're developing antibodies to help fight off a virus. So I don't know if that's a claim that's kind of been stretched to say, it's changing the DNA. That's the only thing that I can think of, but that's a real stretch. It doesn't actually change the DNA of the cells that we know of thus far with what's been shared from the pharmaceutical companies and the research.
All right. Let's talk a little bit. We don't have much time left. So I want to make sure that you get a chance to say what it is that you really wanted to say when you came out. And, Gerald Durant, you've been working for the city fire department for decades, president of the LA City Stentorians, which is the Black firefighters organization. And I feel like we talk a lot about ICU getting overwhelmed. What about, your capacity as emergency responders getting overwhelmed? And what would you want people to know at this moment as we look at entering another stay-at-home order starting tomorrow?
Well, don't panic. Hopefully from the last stay-at-home, you still have some supplies left so you don't have to run out and buy all the papers and stuff that's out there. But just hunker down. It'd be a good time to reset or rewire your life. Read some books. Just trace yourself and calm down. Look at what's going on. Do research. I mean, we have these smartphones that we're able to look up things and find information and read it for ourselves. And then from there, I think some good questions come out, and we'll find those people to answer those questions.
Right. But when you do that, but just let me interject here, Gerald, Durant. When you do that, please consider the source. Everything that pops up on your smartphone or the internet is not true. In fact, most of it isn't. So look at who's writing it and why they're writing it and what are their credentials and what are their resources, their sources. Okay, sorry, go ahead.
No, I totally agree with that. That's the same thing. You're always going to have to figure out who's giving the right information. If you read enough stuff, you'll find out where the right stuff is coming from.
Definitely.
Information. The scientists that do this as part of their life skills, those are the people to trust. Those are the people that know what they're talking about. It goes out and, it's just like one of those circles you have when somebody says one thing, by the time we get around to the 10th person, it's changed 40 times. So try to get to the source. CDC, all the other information is out there, and they know because they're in the game every single day. And in the fire service, we still are always trying to maneuver ourselves where we can keep the public safe and keep the members of the fire service safe as well. So we take out precautions, and I think everybody else should kind of understand that is the key. Take the precautions that are out there. Wear your mask, wear your gloves, clean your hands, and be calm. Just clean up your stuff all the time.
And I want to thank you guys too for what you do, because we talk a lot about doctors and nurses and and first responders, and the fire department is playing an outsized role right now in providing emergency care and responding to people as well, and I think I definitely am thankful for that.
Well, thank you. We appreciate the work that you do getting out the information as well, and I think as far as our community is concerned, we have to keep putting out the information. We have to keep having discussions to help rein those folks that are on the outer edge of understanding and communicating, get them onto the right track. I think that's where we're going to be out. That's our best way to do things.
Your website, Mr. Durant?
It would be the Los Angeles City Stentorian.
Okay. Find out more at Los Angeles City Stentorians. Nurse Alice Benjamin, what would you leave us with this morning on the eve of yet another stay-at-home order?
I know everyone's tired of these restrictions and their masks and all these things, but I promise you, that is going to be the best way. It's the best solution to this is going to have, to be preventative. We have to be preventative, because once you get COVID-19, that's when this whole cascade begins. And we talked about people getting it and then recovering. Well, there's still some studies out there that are showing that people aren't fully recovering. They're having what they're calling COVID fog and muscle aches and pains. So there may be some long-term effects of COVID that we don't know about. So I would like to help prevent people from getting it. Social distance, wash your hands, wearing your mask. And if you're looking for a good Christmas gift to get someone, get them some of those things, masks, hand sanitizers. And one of the tools, someone asked me, Ms. Alice, what can I do outside of going to the emergency room all the time with every scare? What can I do? Recommendation is, you've seen those pulse oximeters, those little things you put on your finger that reads your oxygen saturation. Well, studies have shown that one of the earliest warning signs that someone might be deteriorating from COVID is that oxygen saturation number starts to drop. It starts to drop below 95, below 94. And so they're like $20 on the internet. I would recommend, almost like having a first aid kit, I would actually recommend, and I have one in my house, a pulse oximeter as well. It's kind of one of those measures you can do. Like you have Tylenol, you have, your chicken noodle soup, you got those things to take care of.
All right.
Sick.
Okay.
Your first aid kit.
It's a great idea. All right. Well, we're out of time, but that is great advice, and we can find you at asknursealice.com. Thank you guys both so very much for being with us this morning.
Thank you for having us.
I'll see you guys on Monday. Hey, listen, Christmas is literally canceled. We've got 3 weeks of stay-at-home order, so start getting it together to change your plans right now. We got to go. Passing the mic to Guy Black. Don't forget, the KJLH Men's Empowerment Summit is right now at kjlhradio.com. Until next time, my radio free family, one love.